Hello, everybody. My name is Grace. I'm a licensed clinical social worker with the Outpatient Behavioral Health Clinic here at KSB. September is Suicide Prevention Awareness Month. So we just have a few slides, brief education, warning signs, good stuff like that to share with you all. So we'll get started. So first of all, the prevalence of suicide, why is it such a growing thing now? Suicide is a public health issue. From 2021 to 2022, the number of deaths by suicide increased by 2.6%, which is a record in our country. Something to know, to look out for: males make up 80% of completed suicides. And also noted, different ethnic and racial groups are affected by suicide at a disproportionate rate compared to the total of the population. A really crazy thing to think about is that one death is every 11 minutes in 2021, people affected by suicide. So it's big. Here are some of the risk factors to look out for, to be aware of, to be in the know about. I'm going to restart this. Here are some risk factors that research has shown to maybe make the risk of suicide greater. If there's a history of suicide within your family, or a history of depression, or any serious mental health illness, substance abuse or addiction, if you struggle with that for a long period of time, or if that's used as an ongoing unhealthy coping skill, serious or chronic medical illnesses, chronic pain, a history of trauma or abuse that hasn't been addressed or treated, prolonged stress that has been addressed or treated, a recent tragedy or a recent trauma, a recent loss, ongoing financial or legal problems, being isolated. Isolation is a big symptom of depression. The more that you isolate, the greater the depression becomes, which can lead to suicide. High conflict or violent relationships in the environment that you're in, or even discrimination. Now, here are some protective factors, so things that can reduce the risk of suicide: knowing and practicing effective coping skills and problem-solving skills, finding your reasons, the things that sustain you, whether that's your family, your friends, pets. Maybe you really love your job, or you have a connection to somebody in the community, or grandkids that you want to see grow up and be there for. Having a strong sense of cultural identity, support from partners, friends, family, loved ones, feeling connected to others, feeling connected to your school, your community, your workplace, having a high quality of your healthcare, doing things for yourself, your self-care, going to the doctor regularly, doing things throughout the week that care for you, going to bed on time, having a good diet, caring for your body overall. Cultural or religious community beliefs can also be a protective factor as well. All right, so we also need to know the warning signs within ourselves or in loved ones. If you notice somebody that's talking about wanting to die, even if they come across it as a joke, we need to take that seriously. Talking about the feeling trapped or being unbearable to the pain, or feeling unbearable pain, excuse me. So this kind of, feeling hopeless or having no way out, having no purpose. Consistently talking about being a burden to others and truly believing that. Increasing the use of drugs and alcohol. I mentioned earlier that drugs and alcohol can be an unhealthy coping skill. Those things are used to numb pain or to be able to forget pain sometimes when using in excess. Acting anxious, agitated, or reckless, just really not acting like themselves. Any big changes in eat or sleeping habits, withdrawing, isolating from family and friends, displaying extreme mood swings, giving away important possessions, things that that are really important to that person that they would never want to be without, and then saying goodbye to loved ones. All right, so this is 5 action steps. This is how we show support to someone who's in great emotional distress or pain. So the first one is ask. Be blunt about this. Say, are you thinking of killing yourself? Be direct. People will be honest at this point. Keep them safe. Reduce access to lethal items or places. If you know that there's a firearm in the home, or if their job can be dangerous at times, be there. Listen very carefully and acknowledge their feelings. Validate that the feelings that they're having are incredibly difficult, whether or not you understand them or not. Help them connect. Call or text 988, the Suicide and Lifeline crisis number, or have them call, somebody that they trust. Call 911. You can also always, always, always go to the local emergency room department, and they'll help you there too. Stay connected, follow up, and stay in touch after a crisis. Especially in extreme cases like this, having somebody to know that they're there for them is so helpful and so important. Not even to say that or be worried about, I don't want to overstep or bother them. Caring for somebody isn't a bother. Here are some resources for yourself or for anybody. The 988 Suicide and Crisis Lifeline. You can always call or text and talk through with anybody, and they'll guide you in the right direction. Again, community resources, our outpatient behavioral health department. There's several other resources in the community. If you ever wanted to reach out, you can absolutely do that. You can leave comments in the Dropbox down here. If you have any questions, feel free to screenshot this, and I think we'll enter it in below. Again, thank you for listening, and hopefully this was helpful.